Good morning, Sarah.
Hi.
Hi.
Hi, I'm Nicole.
Hi, Nicole. Nice to meet you.
Nice to
I'm
meet
Matt with
you.
Speech and Swallowing. Do you know why we're here today?
Yeah, you're here to talk about my eating.
We are. We're here to talk about what we found when we did that study yesterday. Do you remember we put the tube up your nose?
Yeah, it was awful.
It is awful. A lot of patients feel that way. I feel that way. I hate it.
Mm-hmm.
I've had it done. So if you look on this machine, I'm going to hit play. This is where we were feeding you the water that was colored green.
Mm-hmm.
If you look at those two little white areas down at the bottom, you'll see that's your airway. That's your trachea, your windpipe. The water just flows down in, straight down into your windpipe and towards your lungs. Before the swallow even happens, as you can see, it's happening right now.
Mm-hmm.
But the water's been flowing in for a couple seconds already now.
I don't think that she really understands what that means.
So what that means is when you're eating and drinking, things that you're eating are moving down into your airway and into your lungs without you even feeling it. There's no cough, there's no choke. And that's something we see a lot of when patients have had treatment with radiation to the head and neck.
And they all have to get feeding tubes in their stomach?
At this point, the only thing that would be safe for you would be to no longer eat by mouth. I have to agree with the doctor's recommendation that the safest thing for you to do is to eat with a feeding tube from now on.
That's how she
I don't
gets. She's just
want it.
completely defiant.
Well,
Not defiant. I just.
Well,
Would
you're
you
not
want it? Would you
considering all
want a
the
tube in your
options.
stomach?
No, I don't. But it's not about me. We're talking about you.
well, Nicole,
Listen to
let's
her.
give Sarah a minute to process and to really think about this.
And it's
If
not
she'll
like
think about it.
not like my NG tube. I'd have to keep it there for the rest of my life. Is what they
You
said.
would, yeah.
You would. Nicole, you and I, we can't really relate.
No.
We've not experienced this, and hopefully we won't.
And it's
This
true
is
that
hard.
I won't ever be able to eat anything ever again. The rest of my life.
You won't, it won't be safe. So the decision has to be, would you like to continue to eat and take the risk of developing another pneumonia? If you remember, this last pneumonia was pretty bad.
Yeah, she almost died.
You could have died from this last pneumonia, and the next pneumonia could be worse.
The tube's not worth it to me. I'd rather eat.
You would
Life is a
rather
risk.
eat than not be here at all. So you would rather eat, run the risk, which is a high risk, probably get pneumonia, and probably die.
Got better last time. Yeah,
So,
it's not worth it. I mean, it's just not everything. It would ruin my life.
so it sounds like you're saying to me that without eating, life isn't worth it, and it's worth it to take the high risk of developing a fatal pneumonia
Exactly.
instead of giving up food.
Yes.
Why do you feel that way?
Well, you know, my whole life revolves around food and meals and hosting holidays and dinner and going out to eat. I mean, that's like the only thing I enjoy, and all of my experiences in life have been, all of my happy memories in life revolve around food.
I mean, our family always had big parties and family dinners, and Sarah kind of took over the role of being the cook later on. So I can understand why you're saying that, but
I can't imagine enjoying life without it. Is it worth living if I don't enjoy life?
well, you
Well, let's
could
go
be
back
there.
to what you said. You said that your life revolves around food,
Yeah,
and that food is the center of happiness in your life.
exactly.
Is it the act of eating and chewing and swallowing that you think is where you get all of your happiness about? Is that what you're telling me?
Well, yeah, I love eating. I love trying new things, trying new recipes, and going out to restaurants and trying their new dishes. I love eating. I do. I love it. That's not all of it, obviously. I mean, there's more to it than that,
Okay.
because it's my relationships all revolve around it. That's what my friends and I do. We go out to lunch and dinner, and I always make Thanksgiving dinner for everybody, and I always like host the birthday parties because everybody knows how much I love to cook, and I have a nice house, and that's how it's always been. So
Wouldn't you rather be there for those experiences then?
So it sounds to me like you're saying that the eating is a part of it because eating is enjoyable for everyone. People like to eat. Everyone likes to eat. But a large part of it too is the social aspect and the sharing and communication and the friendship that happens around food. Is that right?
well, yeah.
So do you think that it's possible to have a healthy friendship with people and not eat?
I don't know. I see what you're saying, but I can't imagine it. It's really hard for me to imagine that. I don't.
Well, do you think it's possible for some people?
Yeah, some people, but a lot of people don't care about these things. I mean, this is what my life is based on.
It sounds to me like your life is based around food and friendship. Could you be happy basing it around friendship
I don't know.
and being around food but not eating?
I don't know. Maybe. I see what you're saying. It's just, it's really hard for me.
No one's saying that it's not difficult for you, and we get that, but it would be good if you could consider both sides and really think about what you'd be giving up if you were going to take that risk of eating.
I can think about it.
It sounds to me like you're having trouble getting past a mental block where food is the central point and you have to have the food. What I
Yeah.
want you to do is try to stop when you get that thought. And try to imagine yourself having a meal with your family and you're eating and you're having a good time, but you're not actually, they're eating and they're having a good time, but you're there enjoying their company but not eating.
Yeah, I see what you're saying. I can try.
Try to visualize that.
I can help. I mean, Sarah always cooks for my birthday that's coming up, so I think that together we could maybe visualize and talk about all the good aspects that you would enjoy of that other than eating during this week.
Yeah, we could try.
All right. That's your homework for this week, because you're going to be discharged soon. You have the feeding tube for now. I want you to think and really consider, try to get past that mental block by visualizing, and then come see me in a week or so as an outpatient, and we'll talk. And ultimately it'll be your decision.
Okay.
Does that sound like something you can agree to?
Yeah. Yeah. That sounds good. I'll give it some thought.
Okay. Do you have
Thank
any
you.
other questions I can help you with?
No, not right now.
All right.
Well, thank you. I couldn't get her to this point myself, so.
Well, thank you for being
appreciate
here to
all of your help.
support. You're lucky to have such a nice sister.